Akwaba to all of you.
Bon arrivé.
Distinguished ladies and gentlemen, please help me welcome Professor Na John Nabila. Thank you.
I'm highly delighted to be part of such a historic event. As a traditional and a statesman, I have a soft spot for the vulnerable and the deprived in the society. My agreement to chair this function stems from my conviction that we are running late in reaching out the most vulnerable who desperately need our support. Ghana's district health system dates back to the late 1970s and sets the platform for its national primary health care. It has since been described as the bedrock of the national health system. Those significant gains have been made with this policy. Implementation has not been as smooth as expected. Several initiatives have been introduced over the years, mostly focusing on the community level engagement, including several training of community involvement and traditional birth attendants. It was found that without adequate supervision, community ownership and financial support and programs were not sustainable. These are some lessons learned which I believe we have gathered here to share and revise our notes. Community health workers have become a pivotal part of major ongoing health initiatives on the continent, as they are a significant platform for the delivery of the life-saving interventions. As the world transitions into the Sustainable Development Goals, it is just timely that we consider investing in community health workers if we seek to build a strong health system to aid our steps towards achieving universal coverage.
In the past 4 decades or so, our major health policies have been defined by the need to expand basic health services and to make these services available, especially to people living in deprived areas. Mr. Chairman, about 2 years ago, the Ministry of Health of Ghana and the Earth Institute's 1 Million Community Health Workers campaign, recognizing the potential of community health workers in this strategy, came together to create an operational roadmap to build the capacity of long-serving, trainable volunteers into a national community health worker cadre. The aim is to build a support base for community health officers in their work to deliver preventive and curative services at the household level. Mr. Chairman, this workshop is aimed at helping us find answers to questions that we face when we are trying to provide health care to our people. I am told that 3 focal areas, namely growth modeling, harmonization, and costing, have been tabled for discussion at this workshop. This is to enable us put the issues in context and to structure suggestions for government to adopt. The Ministry of Health in Ghana believes that financing the Community Health Worker Initiative sustainably will provide an antidote to volunteer fatigue most health systems are experiencing as they continually evolve to meet the changing epidemiological and demographic needs of rapidly transforming communities. I, therefore, commend the 1 Million Community Health Workers campaign and the Novartis Foundation for putting this workshop together. It offers all of us the opportunity to compare notes, reflect, and brainstorm on ways to achieve sustainable financing options. Our expectations as a country are clear, and I must admit, quite high. With sustainable financial support options from both domestic and donor agency sources, we envision a society in which all children survive beyond 5 years, all pregnant women have safe deliveries and healthy babies, all people are educated to live healthy lifestyles and avoid communicable and non-communicable diseases, and all people have access to the health care they need. I believe the call is right, and the call is now. Once again, welcome, and I wish you a very successful meeting.
I would like to see us position ourselves to be the first governments at the door of the new global fund once its door opens. As you may know, there is a new global fund called the Global Financing Facility, which is in response to the fact that the global fund for AIDS, TB, and malaria is a vertical fund, and what many of us have tried to do for years is to have a fund that finances systems, not just vertical diseases. So about a year ago, the World Bank, as well as Norway, has started this global financing facility, and it will open its door. It has $800 million pledged by Norway, $200 million by Canada, and $2.6 billion pledged by the World Bank, which will be co-managing this fund. What's different about this fund is that it's for systems, so you can apply for community health workers. It's for systems delivery. It also speaks to, it will deal with ministries of finance, which we all recognize is critical to health system strengthening. So what I would like, what I envision is that with all of the experience here, the brain power, and the capacity here, that we will help position any of the countries that are interested in to be basically the first at the door of this financing facility that promises to help us accomplish what we're all here thinking about accomplishing.
It is my true pleasure today to welcome you to this workshop of the Community Health Workers campaign. The Novartis Foundation has been supporting this campaign as from the start. And the reason why is because we are really convinced community health workers are a fantastic asset to healthcare systems. Not only do they allow to expand access to quality healthcare, when you, for example, connect them through a mobile phone, as Sonia mentioned, with advice from skilled, experienced midwives and doctors through the telemedicine approach, they also empower patients, for example, to take more responsibility in their own, in the management of their own disease, as we do in our hypertension programs, for example, to make sure patients with chronic diseases continue taking their treatment and continue to get good outcomes of their long and sometimes lifelong treatment. But on the other hand, community health workers are absolutely a pillar of healthcare systems nowadays who are facing an enormous challenge in global health. With the rising tide of non-communicable diseases in each of your countries, that is not offset with the decrease in infectious disease or maternal and child health issues, and compounded with the threat of emerging new diseases such as Ebola, we are convinced that community health workers have to be part of the solution to address all this. They can ease the burden on healthcare systems that are overwhelmed with all these different challenges and become the first frontline contact of patients and communities as a whole. So with this, I would love that you go home after this workshop really convinced about this asset. You can deploy in so many different ways, but it's an essential part of your healthcare system. And if you would be convinced about that when you go home after this workshop, we would be delighted.
I'm delighted personally to be a part of this very important, in my view, historic enterprise here today. Over the past several years, Ghana has executed several health interventions, all in pursuit of primary health care. The community-based planning and services, CHIPS strategy, where community health nurses are placed in the communities to provide and promote preventive and curative primary health care services for and with the people. The Health Extension Workers HUE program, where trained lower-level cadre of health workers were assigned to work in health facilities to support health professionals in the delivery of health services. The Health Promotion Assistant HPA program, where graduates of schools of hygiene and the unemployed graduates of senior secondary schools are deployed to provide free basic health screening and health education and health information across the country. These interventions have all generally been rather successful, but there exists a real challenge in financing, sustaining, and expanding access to basic health care as the country's economy slows down with increasing pressure on national resources. This is a workshop which provides the best platform for countries in the sub-Saharan region and the global partners to share and harmonize best practice from various community health interventions currently in place in different parts of the continent. Most importantly, it also offers participating countries the opportunity to devise ways of leveraging technical and financial resources that are currently available within countries and in the international community generally, and develop strong community health systems that will equip their respective community health workforces. I believe that community health workers will empower communities to take control of their health and accelerate progress towards achieving the health-related MDGs and universal health coverage generally. The outcome of your conversations in the next few days and sharing should convince governments, I hope, around the continent to support the financing of community health systems and to go to the SGDs a little more, in a much more coordinated and accelerated fashion. It also offers you participants, participating countries generally, the opportunity to devise ways of leveraging your experience and ensuring, therefore, that you learn the right lessons and devise the right approaches going forward. the one thing that we need to remember as we consider financing, sustainable financing, is that, as I indicated, in many, many of our countries, budget resources are constrained. And while every effort must be made to sensitize ministries of finance to provide more resources for community health, we must remember, especially in countries where there is decentralization, it is important that we remember that we need to by all means, we need to get the ministers of finance to be sensitive to allocating the right amounts of resources to community health systems. But we must also remember that it is important to ensure that the finances that devolve to the communities themselves through the district assemblies are used in support of community health systems. In Ghana, for instance, a substantial amount of budget resources go to the district assemblies regularly. It's a constitutional requirement. And therefore, it is important that at the community level and at the district assembly levels themselves, community health systems are correctly prioritized so that they can receive the right amounts of support from the financing that is decentralized and under the control of the districts themselves directly. So as you deliberate over the next few days on financing, the challenge of financing community health systems, you must bear this in mind. I invite all of you I urge you to speak frankly, to share your experiences generously, and to speak frankly. And while you are at it, remember that sometimes the best thing you can do in these circumstances is also to share your failures, the weaknesses in what you've attempted, so that together we can derive the right lessons from both what you've done correctly and well as what you've done wrong. And on this salutary note, I'm delighted to formally declare the workshop open. I thank you.